Yeah, we're good.
Hi, everybody. I'm Julia. I'm a patient advocate for rheumatoid arthritis. And today, for Talk Over RA, I have my very own physiotherapist with me, Dr. Behtash Bakhshi. Thank you so much for being here to talk about the topic rheumatoid arthritis and physiotherapy.
It's a pleasure.
So just a little bit about Behtash before we start. He's been working in physiotherapy since 2005. He completed an extensive study and work in sports injury and musculoskeletal disorders. He has a master's in science from McGill, as well as his PhD in physical therapy. I am very happy to have you today to not only talk about rheumatoid arthritis, but to discuss some of the misconceptions also in care in terms of the scope of physical therapy with rheumatoid arthritis, and just have a patient perspective, but also the physical therapist and doctor and physiotherapist. So before we get into it, can you speak to me a little bit about what rheumatoid arthritis is for our viewers today?
Of course, first of all, it's a pleasure, to be here, and I hope at the end of this discussion I can, add something, to the audience. So we're talking about rheumatoid arthritis, RA. Of course, we know it's sort of autoimmune system problem, disease. What's going to happen is that our immune system is going to attack to the healthy cell. That's what's going to happen in all types of autoimmune systems. So what is going to cause is in RA is causing inflammation in the joints. In general, if I want to talk, briefly about inflammation, inflammation itself is the first step of any types of recovery. When we have any trauma, inflammation is the first stage. Why I'm explaining that? Because when we want to talk about, using ice or heat or etc., we need to know in what phase of the flare-up we are. So uh, inflammation, it's okay if you have it in any joint, and after a couple of days, the inflammation itself, it's getting better, and then the tissue is going to be remodeled, and that's going to be the healthy process of inflammation. In RA, what's going to happen is that we have overacting, so we have non-stop that inflammation, which we don't know how long that's going to take. That's why we talk about flare up. Period. That could be one day, could be couple days, couple weeks. Uh, and that inflammation in the joints gonna cause some sort of process, some stiffness is causing in the soft tissue. We have different types of tissue in the joints. We're talking about the cartilage, ligaments. We don't need to go in details for those tissues, but that inflammation, because it's an ongoing process, it's causing for sure pain and a lot of stiffness in the joints. If I want to mainly talk about those two symptoms, in the RA, I think, we need to work on those, and we're going to see how the physio or being active, doing exercise is going to help for that process. I don't know if that was enough
Yes,
talking about
absolutely.
RA. Yeah.
Yeah, absolutely. And damage, right? And
Yeah.
damage, sometimes irreversible damage to the joints and tissues, right, of the body.
If that inflammation is not getting controlled,
Mhm.
then the damage is going to happen. When we talk about damage, that cartilage could be permanently damaged. We might have some deformity in the joints. That is stiffness. If you're not working on that, that could go to the phase that's going to be permanent damage on that tissues. Yeah.
So this brings me to why you think physiotherapy is such an important modality for people living with this condition, and how can physiotherapy itself help someone living with rheumatoid arthritis?
Yeah. When we talk about physiotherapy in general, we need to know, are we talking about joint stiffness or cartilage damage, in the RA? But another aspect of the rheumatoid arthritis is that it's a multi-system disease. It's not just one system. We need to know about it. So, uh, of course, you have pain. When you have pain, you don't want to that much, which is normal. You don't want the brain, your body doesn't want to, tolerate that pain, more than what it is. So that's going to affect other systems as well. Like you can't sleep well. when you can sleep well the day after, you're in lots of fatigue, you're tired, you don't want to move, you want to stay in the bed. I'm getting that from many of the patients. Like one day I don't want to, get up. I just want to stay in the bed. Yeah. So when that process or that flare up, it's ongoing and ongoing. So eventually, what's going to happen is that your, let's say, cardiovascular aspect of your body is going to be affected. Your heart is not pumping that well. Your bone density is going to be affected because you're not putting that much weight on the bones. So you're losing some density. Look, we need to know that when we talk about RA, it's not one period problem that might be with us for the rest of our life, many years. And I think more than 10 million people right now, they have RA in the world. So they're living, living is you have to live, you have to manage, to live with it. So we need to take care of other systems. We're not going to say, okay, because I have pain or I have a stiffness, I'm not going to move. No, I need to work on other systems. So that's why physiotherapy or being active is important, because if we know how much activity we can do, we can manage that for the pain and the stiffness. That's going to help us to avoid other problems like preventing or diminishing the chance of a stroke, osteopenia, those other issues that, okay, if I do it for the next 5 years, I can control or I can avoid those, or decreasing the probability, if I want to, use the right word. That's how the physio is going to help in thinking about other systems. Another thing is that for managing the pain, physio can help. Before, I say before, 10 years ago, we weren't that much sure about, how the physio or activity exercise is going to help for the RA. But right now, we know that at least with doing activities, for sure, it's not damaging more the tissue. We know that the chance of flare-up could go down. There's a bunch of research done, two main research, 2022. We can see that no, for many of those, the real exercises is helping or being active. When I say physio is not only the exercises. Physiotherapists can evaluate the patients. Again, we talk about sometimes, I'm talking about different topics, but as a physiotherapist, when I'm looking at my patients, I might look at different joints. RA might, in different persons affecting different joints. Someone's going to come complaining of more wrist pain, someone in the knee or ankle. So physiotherapist going to evaluate what joints is problematic. And then based on that, we have some physical examination tools. We can see how bad is the stiffness. Something I have to mention here, some cases we have a stiffness in the patient, some we have instability because the joint's going to be stiff on one direction, the other direction are not that much stable. So physiotherapists can evaluate that, and based on what they find or what we find, we can treat the patients. That treatment could be some modality for the pain, some simple things, TANS machine, transcutaneous electrical stimulation, TENS machine, like Dr. Who's, that can help, with less side effects, but decreasing the pain. So giving you a bit of boost to do activities. To the manual therapy, moving the joints, to the exercises, or a modality like a heat and cold. So that depends on, the stage of the RA, how bad or good is that, and the different, elements.
You just gave me so much knowledge that was so helpful, not only for RA, which I really appreciate, but also the comorbidities that come along with, losing your physical activity, losing your mobility, and needing to keep it going. And I really appreciate you even like talking about the evaluation aspect, because I really wanted you to speak as though you're speaking to a newbie, complete newbie. So if someone doesn't even know what physical therapy is, physiotherapy is, you mentioned the evaluation, and then you mentioned also that there are exercises that I know from working with you that he's wonderful at helping me to not only do exercises, but he shows me how to do the exercise correctly. He'll give me some cues on how I'm moving, how I could be moving differently to cause less pain, to help with stability, with strengthening my muscles around my joints that might be unstable, as he mentioned. Then also, if I'm very stiff, I might be working on flexibility with Dr. Bakhshi, and he has given me a plan, which we will talk about in a little bit. So I also wanted to talk a little bit about the frequency of treatment for someone with rheumatoid arthritis. I know you mentioned everyone has different issues when it comes to, you know, what joints are affected or their fatigue level, but what is appropriate for someone that is living with rheumatoid arthritis in terms of like the frequency of treatment per week, per day?
Yeah. First of all, it's really, depends on the individual, I can't tell it for everyone. But one point, I have to mention here is that part of the rehabilitation in general or physiotherapy for the RA patients is to make them independent. So it's not like someone come and see me for herniated disc. I don't want to see you twice a week, once a week. Not really. Part of my goal is to make you independent, to understand what's going on. Because again, you're gonna live with it. You have to deal with that, and you don't have access, or you don't need to see someone to, for a simple flare-up. If it's flare-up, you need to know how to do with it. You need to know your exercises plan. So frequency, maybe at the beginning you need a couple sessions to learn about the whole process or exercises, but the rest, the best coach is yourself. You can understand when is the good time to do the exercises. If you have a flare up and you're in too much pain, you can't do that much exercises. You shouldn't do that because you're gonna hurt yourself. You're gonna experience more pain. So it's in the acute phase, you have to use the medication, be active, but in general, I have a rule of thumb. I'm going to say not more than 10%, pain is good. You have to understand that pain is something subjective. I don't know how much pain you have. You don't know how much pain I have. It's something you know about yourself. So the things is that I want to know is that whatever you do today, it shouldn't affect more than 10% of your pain level by tomorrow. And if you see tomorrow you have a good day, we know that was good.
Okay, then continue on, right? So
That's
if you
it.
don't,
Continue on.
experience more, continue on, keep building, but
Yeah.
listen.
And best time to progress is that when we don't have the flare up.
Yeah.
So if it's cool down, we know that okay, that anti-inflammation process, inflammatory process is a bit under control, maintained or controlled. Now it's time to progress that. So if I want to advance, the exercises a month, something that might be interesting is that, again, it's my experience with the RA patients. It's better you set up your goals by time than, let's say, by how many kilometers you're going to walk, because that you can control. If you do the exercises for 15 minutes, no matter how much is the pace, because if you have a flare up, you might do those movements way slowly, which is good because you control the pain, but you're still active. So if you can, manage that, you're going to get a better results because you can be consistent with that. So
Well,
if I'm doing
consistency,
yeah,
right? Sorry,
yeah,
I need to cut you off. I just thought consistency is such an important word. And how do patients stay motivated to do their exercises when they're in pain? And it is important, as someone that is living with RA myself, I feel very motivated at the beginning when I first see you with our plan. I have it printed out. I look at my plan. I have it in front of me where I am every morning, so I know I'm going to do it. But then you lose that motivation, or you have a flare up and it sets you up to just not want to continue the plan. So I'm wondering if you have any advice for patients that are having that issue.
yeah. For many types of chronic pain, it's a problem because you're going to lose the motivation. So a couple of things you need to do it. First of all, take it simple. The goal shouldn't be crazy. I'm going to suggest, the day that you think that, okay, motivation is not there, that day you need to do the exercises. Instead of doing it 45 minutes, do 2 times 10 minutes. Break it down, to the small sessions. Do it with friend. Look, if you can find someone that have something, similar, or even, want to be active, do it together. That's going to help you. Team up, that's going to help you, giving you more motivation to do it. Using something like a smart, watches, which is going to give you something that, oh, every day consistent, I have 2,000 steps, and the goal is going to be, increasing it more and more. Things like that. Plus, changing the exercises program. If I'm doing one exercises day and day for a year, it's going to be boring, You need to change that. You might go for aqua therapy, just walking in the pool. We know that that's good when you have a flare up. That is a half of, body weight on the joints. So joints can tolerate it more. So if it's a very bad, flare up, I can do, maybe I change it, for a month, I'm going to go for that one. After a couple of months, maybe I'm using, some aerobic exercises like elliptical. So it's like any other things. If you have one dishes everyday lunches, it's gonna be boring, even it's
Yeah.
amazing, dishes. So you have to change that. And goals should be really achievable. If I give you tons of exercises, ask you to 2 hours a day, that's not doable, not feasible. You need to have small sessions you can control. And I'm gonna suggest go for 200 minutes a day. Even if you can do in 3 shots, 10 minutes, that's doable. You can do that.
Yeah.
And keep it, consistent. Sometimes doing exercises, following, some channels like what you have. That's amazing. I'll watch, your videos,
Thank you.
those are very good
Thank you.
because
I appreciate it.
it's your perspective, the way that you're tolerating, you're changing position, going from lying down to sitting. Okay, I have to use my wrist in a way that's not gonna, cause too much, pain. So following those things is gonna be helpful. Sometimes if you know your routine and you're watching something, you're watching a series in Netflix. Okay, I'll do that. Every day I'm doing, one episode. I want to do half of the episode with my exercises. So those are things, making those exercise activity as your routine. That's basically my suggestion.
That's very helpful. Really, really, really helpful. I love all of those ideas, and I'm going to implement them right now into my life. Um, I wanted to also discuss the ice and the heat just very briefly with you. It's something that we had talked about recently, and a lot of the time people living with rheumatoid arthritis might have a flare-up and might be experiencing inflammation in the joints, but they might also be experiencing stiffness at the same time. So I just wanted to get your take on when to use ice, when to use heat,
Yeah,
and for how long ish.
of course. Yeah. So inflammation and stiffness, usually stiffness going to come after inflammation. So both of them are not pleasant, painful for sure. But inflammation is mostly prior to the stiffness. Then we have inflammation, the joints getting big, swollen, because there's going to be a lot of circulations and lots of factors going there in the cells. That episode, when we call it acute phase, usually ice is going to help better because it's decreasing circulation. So if you want to think about it, you put ice, circulations at that area specifically is going to go down because the artery is going to be a bit, shrinking. So
How long would you put ice on the joint? I'm
what's
just
that?
my elbow. How long would you put ice on a joint?
That's another thing. If you put ice for too much, you're going to get some reverse effects. So after 20, 25 minutes, because there's going to be less circulation, you might have an attack of the blood cells there. So not more than 10 to 15 minutes. So if you want to put it 10 to 15 minutes, but every couple hours, that's going to be the best for that inflammation, phase. And just be careful because we're talking about, peripheral joints. Don't put ice directly on the skin. Always you need at least 1 or 2 layers of towel because we don't want getting that response on the skin receptors. Again, that's going to, affect some inflammation or burning the skin. We don't want that to happen. But 10 to 15 minutes is good. Stiffness, in the other hand, we have a lack of flexibility. We need more circulation because if this is like most of the RA patients complaining of the morning is stiffness What's going on is that when you sleep at night, your circulation is going down. So blood is going down. In the morning, you have more flexibility issue. Then you need 1 hour eventually to move, and circulation is getting better. When circulation is getting better, usually you experience less stiffness. So that's when we have a stiffness, heat could help. Same rules, 10-15 minutes, very gentle and not directly on the skin.
So would you put some heat, not directly on the skin, which is so helpful to know? I think a lot of people, there's a misconception there. Would you add some warmth, some heat before moving in the morning, or
Look,
just curious?
again, the nature of flexibility issue in the RA, heat is helping temporary to increase the circulation. But
Mhm.
better than the heat is the exercises. We know that if you do exercises the evening before, you might have less morning stiffness. That's again another research, I went through it, a couple of years ago. If you do more exercises in today evening, tomorrow morning your stiffness is going to be a bit more manageable because you're changing some things in the soft tissue. So heat temporary increasing circulation, so that's going to help you to deal with it. But again, it's not the solution. If I wanted to compare exercises and heat, I would suggest exercise is going to be way more vital than the heat. It is something that, oh, I have a very busy day and now I'm very stiff. Let's
Mhm.
put some heat to give me, that lotion, to move it a bit more. But that's not some treatment I'm gonna say, oh, if I put everyday heat, I'm gonna, fix my flexibility issue. No, joints is gonna be stiff unless you move them, unless you use those, different types of collagen fibers, to increase the flexibility.
You're helping me segue directly into September 24th, 9 a.m. morning movement with the RA Yogi. It's just specifically for people with rheumatoid arthritis, doing some joint freeing, moving the whole body mindfully in a seated position. So of course, if someone living with rheumatoid arthritis can stand and they're not too tired, there's no pain when you stand, then you can take these exercises standing. So I just wanted to mention that. So that is uh, very appropriate because it will be at 9 a.m. and then this session is at 2 p.m. So there's a lot to learn here. Very helpful. Thank you very much for those answers. I did not know about the evening activity. Moving the body at night would help with morning stiffness. I had no idea. So you just completely educated me there. It's very, very smart, actually, now that you think about it. But you don't think that after sleeping a whole night that it would affect the body in the morning, but it does, right?
It does. And when we talk about exercises is trend right now for many, many problems, not for the chronic, disease in general, for many things, because like human body designed to move. We know
Yes.
that. So one of the reason I'm emphasizing and doing exercises for RA patients is that eventually, if you're not moving, you're affecting many things. When we talk about evening exercises, not only it's going to be good for the morning stiffness, it's good for sleeping at that night. Any types of exercises in the evening, we know that that's going to affect the way you sleep. You're going to have a better sleep. Even for the healthy human, if they do exercises, they're going to have a better sleep. You have a better sleep, you have less fatigue. Less fatigue, not in, general, all tissues less fatigue because, the body designed to get rid of the fatigue through the night. So if I have a better sleeping the day after, my tissues, my joints going to be a bit happier. So that's a system. That's a system it's going. So if I have a discipline, I try, to have a good sleep, follow my exercises, I'm going to put less pressure on the joints and tissues.
And when you say that, I like happy tissues, by the way. When you say that though, when people think about exercise, we're not thinking intense exercise right before bed. We're talking about
Very gentle exercise. Look, different types of exercises we have in general, specifically for RA. First things is that to keep the range of motion. So in your limit, I don't want you to feel a stretch or feel pain. Just keep the range. So if my wrist has a bit difficulty, I'm going to try to reach my range actively. Okay. And usually we say repetition 10 times. And the pace is not important. The slower, better. Because, if you do it fast, you might feel more pain. That's true. We don't want that. We just want a gentle range of motion. Depends on the condition. When there's no flare up and you feel, oh, it's good. I'm feeling better today. That's a day maybe you need to do more strengthening exercises with a small resistance, let's say. So if it's a flare-up situation, I don't need to do weights. For sure, that's going to be intensive. Intensive exercises is when the condition is under control and we don't have that much flare-up. That's a time we can, move on to build more muscle. But any day exercises, no, it should be combined of the range of motion exercise, a bit of aerobic. Aerobic, because we need to increasing circulation in general. It could be a stationary bike. It could be any walking, very, very light walking. It could be walking in the pool, any types of, exercise, but consecutively because we need 15, 20 minutes for the heartbeat to work. So if I do 5 minutes, that's not gonna, really help that much for the cardiovascular. I need minimum 20 to 30 minutes. But again, I don't want to put that as my first goal. If I'm in a very sedentary, condition right now because of the pain, I'm not, moving that much. Set your goal for 10 minutes for now.
That's really good
The
advice.
week after 5 minutes. Usually we said that every week you can add, 5 to 10% to that to reach that 30 minutes.
It's so motivating when you say that because it makes me feel like it's doable for so many of us at home that are not as mobile. And I actually practiced a seated Zumba class this morning with my friend Christina, who's also a part of the campaign. She's a patient advocate. And she was doing the standing and I was watching her. I'm like, how is she doing all that? But I was doing the seated variation and my heart rate was going up. I was breathing a little bit more heavy. I was moving, still seated. And it's not because I'm promoting sitting. I understand that doctors don't like that, but sometimes we don't have a choice. Maybe that is where we are in our lives. Maybe we're in a wheelchair. Maybe we are just not capable of, long periods of time standing, walking. So I think it's so wonderful to find that you can do these adapted types of exercises or start small, 10 minutes, 10 minutes, build by 5 minutes. Like you said, it's very, very motivating.
You're right. When you're doing it, you can do the exercises in sitting position. You're working on different joints. If you want to work on your wrist or elbow, it doesn't matter you being standing or sitting. So if I have a lot of pain in my hip today, why not? I'm gonna do sitting, chair yoga. I'm gonna do something on my upper limb joints. The other day that I feel better in the hip because that's the nature of RA. That's, could affect my hip today more.
It
Maybe,
moves
yeah, maybe in a
from
couple of
joint to
months.
joint.
So that's it. We have to be realistic what's going on and just keep moving. So
And so
if my hip is bad, I'm gonna work more on my shoulder. If I do some rowing, I can, it's still increasing my circulation. I can work on my heart, health. So yeah, we need to be realistically and based on person. That's why, it's not one exercises program for everyone. But the best person can coach it, is the patients. You know that you need to learn what's going on.
But having a doctor there too, having a physiotherapist that has the knowledge to help you further your situation in a positive way is so important. I just really wanted to bring physiotherapy to light here, that having the education from the physiotherapist, if you don't have this background, if you didn't have a background in physiotherapy or health or fitness, seeing a physiotherapist can help to get specific exercises that are meant for you and your condition. Like for me, we are working on my knees, and just really briefly, I have his program with me. Oh, you can't really see because I have a blurred background. Oh, there it is. Okay. So you can see he made me a little program. Okay, I will unblur my background, but don't judge me, guys. Okay. One moment. Okay, here we are. So as you can see, he's given me little pictures that I can do. We're working on stability of my ankles, my feet, my knees. You can add in if you think there's anything else that I'm missing that I need to know. So we're using elastic bands that you can easily buy online or purchase in the physiotherapy store. We're using a chair for balance, maybe a yoga mat and a cushion or some kind of pillow, rolled towel, a yoga block for underneath the knee. So we're really working on my knee stability and my strengthening my quads in these exercises, right?
Yep.
And
As you said, some cases like, your knee, we have some instability. For that instability, what's going on is that, okay, the ligaments are not working, properly, but we can use the muscles to holding it. So that's why we kind of start working on the muscles, different groups of muscle to build up, a bit of strength there. Yeah, the ankle as well.
the ankle as well, because I'm hypermobile is what you said in my ankles, right?
Yes. Yeah,
And
hypermobility in one direction. Yeah, we decided to do that. The other one is the for lumbar. We try to give you a bit more flexibility for rotation for the lumbar and the hip.
and
The other
here,
one, we noticed a bit of, stiffness in the plantar fascia, so we decided to give you that exercises to help a bit on the plantar fascia. Yeah.
that's a towel if you guys don't see. It's a little towel. I'm doing little scrunches with my feet. And then we have the last one's a lot of bands with Dr. Bakhshi, lots of bands because they're so useful. Oh, this is the same exercise. Hang on. There was one more. Oh, this is the one I wanted to show you. So this is for calves and for feet and ankles, right?
Yes.
Or for the
Yeah.
calves though, or?
They're working on all, but mainly for the calves. Yeah.
So this is what we're working on right now, but as you said, things move around, so we focus on the priority, and this is what I wanted to just kind of not end with, but I wanted to talk about how we have to prioritize, like you said, when we're focusing on a whole body, it can become very overwhelming to do. Obviously, yes, you want to work the whole body, but we're just focusing on the knees because that's my biggest pain point, right? And even though I have a lot of spine issues, and this is something I spoke with Dr. Bakhshi at our last appointment, is that I have a severely degenerated spine, likely due to my condition and some injuries from my past. So when I wanted to work on the spine, he said, yes, but I really, really think you need to work on this first because this is your biggest pain point, but I still will give you some exercise to help with the spine, the spinal twist lying down. If you just wanted to talk about prioritizing certain joints first or why you specifically gave me this program for me in this moment, I just think it would help a lot of people.
So I think, we had a bit of, issue for the connection. I
Oh,
couldn't hear you
sorry.
well for the last just few seconds, but I think, you asked about, how we're going to prioritize, which part we're going to work on. Am I right?
Yes, that's right.
Yep. So same things depends on the flare up, pain. If you have too much pain, in 4 different joints, I'm not gonna, work on all 4. General exercises like aerobic, yeah, they're gonna work, for everything. But for that specific exercise joints, no, I might work on different joints, and wait until, your medication is gonna help you better for that inflammation, process. But let's say I want to work on the spine, but you have, lots of instability in the hip. I'm seeing, okay, you have too much pain in the back. I'm gonna, give it a rain check, wait a bit, work on the hip, working on the knee. In 2 weeks when you got better, we're gonna work more on the spine. But the thing is that you might see me, you saw me 2 years ago and you got a program, let's say for your spine. Your spine's doing better right now. You want to, focusing on the knee, but you still have those programs, you might, adding few of those exercises next time when you feel you're good and the flare up is, subsided, to adding to your routine. And after a while, after, 1 year, you have a good bunch of, exercises planned for yourself, planned specifically for you, so you can try different exercises for different joints.
And if someone came to you, this is something that I just thought about, but it comes up a lot, is that people that are living with rheumatoid arthritis, a lot of us, we grieve the person that we used to be, mainly not the person, but the things we were able to do beforehand. So being able to adapt is very important, but also being able to return to some of the activities we love is so important. And I know you've worked with a lot of athletes. So I'm just wondering what you would say if I specifically said, I want to play tennis again. How do we make that happen? Like,
It's funny you asked me that question. I had a patient last week, and because of not RA, but different types of arthritis. And I told to the gentleman, I don't think you're going to be able to play tennis. He was upset a bit because he was playing, for a good 20 years. I said, look, but you can start playing pickleball. And he laughed. I said, look, there is tons of different sports you can try. I know, but considering, the situation we have in your knee, we might, changing that exercises, that activities, that is sport. So they have to be realistic. I know it's not pleasant to say, oh, you're not going to play this, but you always can play something else. You have to find something else based on, the limitation we have. It's important we do it. And look, you might think, oh, I have to just do this specific sport. Yes, but reality, even for the athletes, I have a, player 3 times injured the same meniscus. He can't play soccer at that, degree anymore. That's a reality. So he might go, to different sports. He might, change being, athletes to being a coach. But lives is going, and we have to find other things to keep ourselves active. So same things here. Yeah, many associations going to help, to understand the RA better. You can talk to your rheumatologist, they know the best. They can, introduce you to, I think MUHC in Quebec, we have, some association as well.
yeah.
We need a lot of education. You need to know what's going on. And based on what's going on, which is my condition, based on my condition, I can be active. I can continue my life. You made a point about RA. You're working as a RA patient, so you need to do different setup for your working. So if you have a better setup, you can tolerate, that position with less pain, and you still can work. But of course, I want you to have a better setup than and your colleague that have no RA. But with a good setup, with a good shoe, if you have a good pair of shoes, you can walk better. So those are things, you might ask even your physiotherapist to help you, or occupational therapist, or your rheumatologist, anyone to change this setup to help you to adapt to that situation better, even to choose what a sport is good for you. In the beginning, I said, if it's a bad day, I can't walk that much, I might find, a public pool or something around, my house, and then go walk in the pool. The more is the depth of the pool, I'm gonna feel less pain because joints gonna be more supported and the weight is less. So it's a very bad day, but still I can go and do that activity that's gonna help me to boost my mood, to boost on other systems of the body. So realistically, there is many things we can do, many things we can do with different, disabilities or limitations. We need to find it. And if you find, okay, what else you can do, you gotta do it. You brought it, you brought up that, oh, I did Tai Chi or yoga on, on the chair. Yeah, why not? I
Zumba.
can do yoga. I'm gonna do, yeah, Zumba on the chair. Why not? You can do that, and still you can get benefit. You're gonna, boost up your mood. That's what we need.
Because there's a lot of resistance. That's the thing. There's a resistance, and it's a mind resistance because, for example, the gentleman that you treated, I'm like him in terms of I just want to play tennis. That's what I was meant to do. I was meant to play. I don't need to play at a competitive level, but I love tennis so much. So when you said that, when you said find a different activity, my heart just sank in my chest, but it's the truth. And just because I can't play like, quote unquote tennis, like a real tennis match, doesn't mean I can't work on my serve. I can't, shoot the ball around, but have someone with me that won't make me run because they're really experienced and I don't have to change directions with my knees as much, right? There's a way to
Well,
make
and
it
don't take me
possible.
wrong, you might be able to play tennis, when the flare up is getting better, Why not? If you do the exercises and then at one point there's a couple of weeks that you see that, okay, the disease is controlled, you might try that day.
Yeah.
You have some weeks that you see that, oh, those days the energy level is, higher, the pain is less. So you might try, something on those days. But in general, if you want to just say, oh, I want to do these activities, and if I can't, I'm not going to do anything else, you're not
Yeah.
going to help each other,
Wrong attitude, right? Absolutely. And it's funny, you just answered so many of the questions that I was going to ask you because I wanted to talk about contraindications. So you kind of answered that already, but just again, to make sure that people are safe when they're moving and they're doing exercise, just speak to what contraindications are and why it's important to respect them as a patient living with RA.
Just one thing I might, I might talk about it, but I'm going to say one more time. When you feel a pain while you do the exercise, it doesn't mean that you're damaging, any tissue more. That's something, is scaring patients usually. You're going to say, oh, I'm feeling pain while I'm doing the exercises, or probably I'm hurting something, or I'm, overusing. No, you're not. That's the nature you feel, because of the stiffness, that joint doesn't want to move. So when you move it at the beginning, they're gonna feel a bit resistance. But after a while, after even few minutes, you're gonna feel that it's getting easier and easier for you. That's why we call it, motion is lotion, is basically based on that. First few reps is not easy, but after that, you feel that, okay, it's getting easier. The only things is that the level of pain, I don't suggest if it's more than 10% of your resting pain. If the level of pain is going more than 10%, you have to push through the pain. No, that's
That's
because
a
you
contraindication.
already you might taking some pain modalities. So
Mhm.
we don't want that. 5 to 10%, that's okay. But
Okay.
more than that, no.
For
But
example, we talked about squatting because I train and I like to move in a functional way. Like I like to do lunges because I lunge in life, or I, pull because I pull in life, push, squat down. And you mentioned don't squat right now because my knees were so swollen. So would you say I was contraindicated to doing exercises that include squats that are weight bearing with my weight?
So in general, I'm trying to simplify,
Yeah.
exercises. We have different types of exercises, open chain, closed chain. But what I want to say that if I'm moving my joints without putting any weight on it, it's just the body weight without a standing on it. Let's say I'm lying down and I'm doing, the heel slide. So this is the less risky movement for the joints because there is no resistance or weight on it. You're just moving the joints. That's the best things if I have too much, inflammation. So if I have a very swollen knee, I'm gonna say don't do squats because the squats, the whole body weight is on the joints. So basically, it's a closed chain, and you're putting pressure on the knee. So if you are inflamed, you're gonna make inflammation worse.
Hmm.
What else you can do? Lie down flat, now bend the knee. There's no body weight on it, but you're still moving it. Let the inflammation is getting better. When it's getting better, you can do other exercises. But those are things, your physiotherapist as well can help you at what phase you're gonna do. But I'm 100% sure if you have a swollen knee, and if you do squats, your pain is gonna be way more than 10% worse. So I don't want you to do that. Very simple. You go step by step. You babysit it today. When you see swollen is getting better, you can do those range of motion exercises with minimum pain. Then it's time, to adding more resistance, let's say, on the exercises.
Thank you so much.
You're
I
welcome.
don't think I have any more questions because that was such a comprehensive, discussion about RA and physiotherapy. If there's anything you want to add, I'm not sure if there's anything you think of that you think would really help someone with rheumatoid arthritis on the other side.
Look,
Green.
most of the things I mentioned, is based on experience I had with patients or reading, being part of their studies. But in general, you have your rheumatologist, talk to them. They might, refer you to different clinics. We have Canadian Association. We have different association. They have a very, very helpful videos, programs. They can teach. I think, before we start this conversation, I checked. They have a bunch of videos in Canada Association as well. Simple exercises they're going to show you. Those are a bit less, contraindication or side effects. Start with them using, some channels like yours, because it's from patient's perspective. Those are important. Like, I might not understanding how changing position is important unless I have the same issue. So following those, for those, you don't need, to get a referral or, spending money, but there's a bunch of things to educating yourself on the condition. The more you know about the condition, the better you can manage it. And you see that sometimes you might need a bit of, advice here and there from your therapist for your exercises plan. Your rheumatologist is, the lead, they helping you for the process, for medication. But physio aspect, many of those, there is many clinics, they have team sessions, 5 per people together. You can, go for those cases if you really think that, okay, after doing all those exercises online or those education, you need a bit more, or seeing, a physiotherapist who's working with the arthritis patients and get a bit of, progress on that exercises. But there's a bunch of things, you can educate yourself, and that's going to be helpful for sure.
Thank you so much. And he mentioned the association, so please do follow the Arthritis Society Canada. You can find a lot of education and resources. As Dr. Bakhshi said, it's so important to educate yourself. I really appreciate your time today. You have a wealth of knowledge, and I'm just so grateful for you as my own physio. So thank you so much for being here.
It was a
And
pleasure. Thank you for having me.
you can find Dr. Bakhshi at AMS Physio Dorval online if you're interested in learning more about his services. I hope that you have a great day.
Same as well. Have a great day.